She wrote the cutest vest.
Oh, thank you. I made it.
Of course you did.
I have an even better one for professional uses. Oh, I've been already filming that. Oh, cute. But I think I myself today.
Yeah. Yeah, I'm trying to get 13 releases out. It was all in way. Oh shoot, I think they came in and get that I'm in a responsible. I think it was just, I don't know, it was like weird.
Outdoor adventures, a thriving cultural scene, and the UNC Gillings Schools Master of Public Program.
I can't confirm that you went back for it.
Just a case.
We're all good to go.
And you're recording this on Zoom, correct? Yeah, I am.
Mackenzie, yeah.
Okay.
Yes.
We're also recording slides.
Yeah, so you should be able to see what everything shared today and then the little picture of me in the corner just speaking. All right, so we are at what? We are right at time. Very, very cool. Let me pass some of these out. So I think this might get a group here today. One, two of that here. Join some of our other events. Remember from what? Wait, was it on coming?
I've seen that. I don't know about that. I'm gonna write something on the board. I'm Deborah, by the way, who you've been.
That makes a lot more sense.
Yeah.
I thought you were getting around.
I'm gonna write a link on the board for people to sign up or like sign in for us.
Okay.
That's a lowercase a. I just write it in uppercase most of the time. If everybody could follow that link so that we can get your payment, great.
It's not easy for you all to see. Yeah, I think it's show me in some kind of. Hold on. Okay. All right, I guess we'll get right into it. Yep. All right. Well, good afternoon, everybody. My name is Cole Gold. I am a recruiter with the UNC Asheville, UNC Gillings Master of Public Health Program, which is the only graduate program here at UNC Asheville that's currently offered. So if you're interested in pursuing and continuing your education and staying here at Asheville, you can do it through UNC Asheville and UNC Gillings. Let's see. I myself am also a Bulldog. I actually grew up here, went to UNC Asheville, got my degree in health and wellness, did a concentration in student research, and went on to finish this actual program. And now I work as an epidemiologist and program manager at MAHEC, which is the largest health center in the state. And we're actually located, do you guys know where MAHEC might be? Maybe, yeah, right in Biltmore Village. So I also had some time in my schedule this time of year to actually fill out with recruiting for the program. So it was actually something I wanted to do. And that's why I'm here talking to you all today. Their agenda, we'll be doing a little bit of welcoming introductions with you all. We'll talk about the MPH program and place-based health. So what that actually means and contextualizing it, and then your next steps if you're interested in applying to the program. Let's see here. Actually, before we do that, I guess with introductions, you know a little bit about me. I'm an alumnus of the program, and a Bulldog, and I currently work for the UNC Health Sciences Department at MAHEC. I'd love to hear from you all. I think you said your name is Mackenzie.
Yeah, Mackenzie. I'm a junior, health science major, minoring in French and interested in DPT PhD programs. So,
Cool.
yeah.
All right.
Hi, I'm Theodora. I am a third year psychology major with a neuroscience minor. I'm the assistant coordinator of the pre-health department here.
Yeah, that's awesome. How about you?
I'm Malin Blackburn. I'm a sophomore here. This is my first year at UNC. Health and wellness major with concentration in public health.
Right on.
I'm a junior, health and wellness major, so health and concentration in public health.
Were you in the back?
My name is Christos. I'm a health and wellness major here. It's my final year. I have a concentration in health sciences.
That's awesome. Yeah, they have way more interesting concentrations than when I was here. I graduated in 2017, and at that time it was just like nothing really. Yeah, they kind of make your own. I did research just because it was the key semester. So, all right, well, cool. I'm glad to hear that most everybody is either health and wellness or doing public health work in some capacity. I like to think that public health is, instead of it being like a terminal or end point for a degree, it's rather something you can do and add to what you're already doing. Because it's more of the study and the science as to how to describe health conditions or factors impacting your health, which can be anything, which kind of makes it a little nebulous to put your foot on. Okay, so I think for this group, I might just go back to one of the slides towards the end because I think it really describes some of the work that you might be interested in. And then I'll kind of go back and talk about what place-based health is. So when I ask what is public health, what would you all say is public health? What would you say is public health?
Focusing more on preventative medicine for the well-being of the community as a whole rather than the individual patient.
That's an interesting take. That is one of the many facets of public health. Yeah, absolutely. It's like health promotion. Anything else? Also, you answer that and have the bravery to answer. You get a squishy brain.
Thank you.
I grabbed these before I left campus today, and people love these.
Yeah, I think I already have one at home.
You have a second. We're good to the friend. Who else? What do you think? What does public health mean to you? You're a senior. No wrong answers.
I guess for me, it's kind of like spreading, study of. Let me kind of words here. I guess it's kind of spreading the community values of public health, kind of spreading it to people who don't have the knowledge for it, maybe giving knowledge to others, maybe creating pathways for people to receive it and kind of spread it along and understand it better than they do prior. So I guess we're on this platform.
I think that's a fair way of describing it. Yeah, it's like health education. See if I can end back there.
It's very.
Well, that wasn't that bad. That was. We need nerds to play sports. Well, anybody else want to answer that before we move on? What is public health to you? What is public health? What's the work that you do?
I think it's the continuation of the study to help people
Yeah.
across the board.
Okay, so it's kind of understanding the life cycle of patients, individuals, the systems they interact with. Yeah, absolutely. That's like a systems approach. There you go. Plan. Cool. 3 out of 3. All right. Well, that's exactly what public health is. It's also really nebulous. There's not one thing you can do with public health. One of my favorite podcasts, if you're interested in public health, is called Everything is Public Health, because everything impacts your health a little bit. I normally don't show this slide first, but I think it's a great frame of reference to think about what is public health very, very quickly with students who are kind of already doing this work or really want to. So when I say what is public health, these are projects that students in our program, which is a master's 2-year program, have done. I'll give you details in a moment, but to really conceptualize, what's the kind of work? What is the everything in public health? Who here is interested in reproductive health and justice? Cool. That is a part of something you can evaluate, research, and publish on with a public health degree. Who's interested in?
I just unmuted it. Yeah.
I don't know if there's gonna be a video recording.
I just remembered that I had it on the notes.
No worries. Okay, cool. Who here is interested in social justice? Yes, only two people? No, I can't, keep pressure, yeah. Social justice is absolutely something that you can evaluate, you can learn about, and understand the science behind as to how it impacts populations of people and the health outcomes of individuals. So for example, these are different projects that students have completed over the 2-year participation in this program. Some of them being with some of our host organizations, for which we have 42 in UNC. And here are the activities they completed. So for those who are interested in more of a clinical facing role, some have worked with the MAHEC school nursing program, developing guidelines for evidence-based health education. For those who are interested in the racial justice component as to what outcome or what factors impact our health, some of our students have completed the Asheville Racial Justice Coalition project work, where they evaluated the reparations process here for Black Asheville. For those who are interested in LGBT+, we work with the Campaign for Southern Equality, and students assess WNC providers' attitudes for transgender health. So there's not just, unfortunately, one thing you do with public health, rather what can public health do for you is how I like to view it. In my work, I get to touch on so many different facets of how to describe community and individual health, because they are intertwined. So now we have a little bit more of an idea that what you are doing is not happening in a silo, that you can actually be focused on one thing and have a degree that supercharges the way you can communicate about that topic, research on that topic, advocate for policy on that topic. We'll talk a little bit more about how you get into a program like that. But yeah, everything from farm workers, migrant farm workers here, also working on vaccine campaigns and health communication for the Cherokee Band of Indians that are here, all go into public health work. Public health is helping the public and their health. All right, let me go back to the very beginning, because we have a small video. It's like 1 minute, but it's pretty good. It shows you the classes, the teachers.
Welcome to Asheville, North Carolina. Here in the heart of the Blue Ridge Mountains, you'll find breathtaking outdoor adventures, a thriving cultural scene, and the UNC Gillings Schools Master of Public Health on the MAHEC. Here, our place-based health concentration equips individuals with the knowledge and skills to advance health equity in Western North Carolina and address the wide array of factors that account for up to 95% of a community's health. Our program leverages the nation's #1 public school in public health, with UNC Asheville's focus on teaching excellence and MAHEC's expertise in rural clinical care. The relationships students form here will support them for many years to come. Classes are held in person 1 day a week to support working professionals and ongoing community engagement. We invite you to learn more about how the Gillings School's MPH program in Asheville can help you further your career and your passion for public health.
Okay, just a little bit of like an understanding as to who we are, where you get to go to school. It's right down the road at MAHEC, even though it's a UNC Asheville, UNC Gillings joint program. So we talked about public health, thinking about the education behind it, thinking about how it impacts or leverages systems, thinks about individuals and populations all at once. It's very similar to how we define the program externally as well. So when we talk about public health, we want to talk about our guiding principles. The program focuses on 4 of them to kind of conveniently go into Compass. Our North Star, our guiding principle is always equity and social justice. We are here to serve communities, serve individuals, and if we're not doing that, we're not proactively and equitably lifting up all in pursuit of better health. When we think about the future, focusing on that eastern direction, talk about prevention. You were just talking about that. Exactly. Thinking about preventative ways, like an ounce of prevention is worth a pound of cure, and thinking about what can you do today that sets up future generations from really disparate health outcomes. when we think about, I guess, southern direction, under our foundation is systems and structures, what we have in place, the way this university operates, making sure that you as a master's student take advantage of your curriculum, become an even more heightened critical thinker, and taking a better understanding of how health systems operate and really impact and put into motion the health and well-being of its citizens. Lastly would be W. So that western direction we talk about, focusing on whole populations. So making sure that when you're thinking about a solution, when you're trying to educate, you are addressing a whole population, not systemically focusing on one group, one specific outcome, but that you are focusing on all at the same time. So this is a collaboration between 3 different institutions. Like we mentioned, we've got UNC Gillings, which provides the curriculum. It's the best in the country. It's the #1 public, not private, public school, public health. Out of all public and private schools, we're #2 with tied with Harvard. It's kind of cool. But so that being said, we have a public health expertise that's now being applied to the mountains of Asheville, the landscape here, and the people that can help lift that up. UNC Asheville helps to staff this wonderful curriculum, bring it to life, and talk to you all. So that's going to be your interdisciplinary liberal arts faculty that you already know and love. Most of them are from the health and wellness department, and a few from other locations on campus if they're interested in being a part. And lastly would be MAHEC. That's actually because there's not enough space at UNCA. There is space at MAHEC, and we have a UNC Health Sciences building where all of this happens. You have your own private classroom about this big, and your whole cohort learns 1 day a week all together. Any questions so far? Okay. So we talked about where do we meet? We meet at the UNC Health Sciences building at MAHEC. That's where I get to work. And our classes are kind of, if you have like Superman vision, like right back here, all the way on the corner of the building. What's really cool about this is that UNC Health Sciences building has multiple programs. So not only would your colleagues, you're in the cohort, be students like yourself if you just graduated and are doing this after their gap year or directly after graduating, there are also pharmacists who work on site. There are also med students who work for the UNC Health Med School. There are also psychiatrists and many, many others. We have a lot of great programs, including the School of Dental on site. So it's a lot of cool opportunities for sharing the knowledge, sharing perspectives, but then also for other professionals to inspire you to do this, and then also go into pharmacy or go into medical school. This is a great pattern for a resume when if you are interested in going to medical school long term. If not, this is a great standalone degree just to be an epidemiologist, population health scientist, or anything else really that you want to apply this towards. So when we think about our concentration, there are 9 graduate concentrations, graduate options at UNC Chapel Hill in the Gillings department. What makes this unique is that all 9 of them, we are place-based. So it's like rural health. So focusing on what happens to underserved, underrepresented communities, but in the mountain landscape. And then on top of that, focusing on how you can implement strategies, solution, educational opportunities to help lift up those populations from the under-resourced access to needs in their area. So when we talk about place-based, we're talking about understanding histories, traditions, spirituality, education, economy, geography, healthcare access that is specific to WUNC, but then also transferable to anywhere else in the world. Because if you learn a lot of these basics, you could probably go to somewhere in South America, somewhere in Canada. You go anywhere else in the world and understand basic frameworks that you can help to then identify, educate, promote, advocate for better conditions or policies for populations. They are transferable. What we're doing here is connecting to local partnerships for WUNC, which does not happen in Chapel Hill. All of your learning is done, yes, in class, but it stays in class. So we like this graphic because it does kind of talk about, if you think about place-based health, it's like a watershed, right? Bringing you back to environmental health. here on campus or ecology and evolution. Everything is recycled. Everything is interconnected and interwoven. And so when we think about systems, we want to think about a few main concentrations, classes that back up your understanding for those classes. So 434 is a class that you will learn. It's called place-based theory. That's where we'll actually go into WNC and have simply field trips, learning from health departments, large organizations or government agencies here in our region, and how they operate, how they do public health, how they work on vaccine initiatives, or how they work meeting the needs of ensuring low-income individuals. Next would be 736, individual transformation. That's a leadership program. This is a program, so our place-based program is a part of the Gillings school, but a subspecialty where they focus on leadership and practice. And that's what you're going to be doing. You'll be learning your Myers-Briggs personality type. You'll focus on a few other tests that show you how to communicate better in teams, how to work across an organizational boundary to see if there's any way of communicating with those who don't inherently already have an established network with you. Next would be research and evaluation methods. This is where you really want to better understand if you're going to stake a claim or to talk about, well, why should we learn more about or create a policy around reproductive justice? You want to say, well, because X amount of individual people are suffering. They're suffering in these ways. And I can now show you what the data set. That's really comprehensive. That's a class that would, in a lot of cases, and how our world operates, influence physicians, influence healthcare organizations and governing bodies that help to create standards. That's because of research and evaluation tools. Next would be community transformation. That's where you actually get to have your class work be attached to local partnering organizations. And so a couple of years ago, the Kuala Reservation, so it's the Eastern Band of Cherokee Indian group here, worked with our students to create vaccine hesitancy and vaccine communication so that people in the reservation could receive a COVID vaccine. They could feel confident trusting their governing bodies there, given historic complications with that and mistrust. So this is an example of how to turn your actual class time into productive work for the community that you are in service to. Any questions? Anybody interested in this already? Or like thinking, okay, kind of doing this? Yes.
So would classes like the place-based theory and implement place-based not be offered at the Chapel location?
That's why you've got concentrations. And I'll show you a better picture of that in a minute. These are all courses that are absolutely specific to our concentration. There are a few more that change every year depending on available electives. We call those selectives because they're selected for you. One that they're offering right now is migration, human migration, to better understand how people's movements, whether voluntary or involuntary, has impacted their health and their long-term descendants. So yeah, things specific just to this concentration. If you're doing nutrition or child and maternal care, you have specific questions. So yeah, last would be, or we've got last two, systems transformation. That's learning about case-based examples on how to leverage change within systems. So looking at a hospital or a health center or a health department, or even a NGO, and how they set up either successfully or unsuccessfully a health program. And lastly would be implementation or implementing place-based solutions. So teaming up with work in WNC organizations, and again, working on more of those solutions that would impact communities in WNC. So we talked about this a little bit already. This was just another slide that helped to conceptualize some of these courses, but you take them in order. You know, they get increasingly a little bit more involved. Okay, back to your question. So with Gillings, of course, we have 9 graduate concentrations, 9 versions of the same Master of Public Health. And what's unique about our program, we just talked about the place-based approach in the classes that you'll take. You have the Gillings Public Health Core. Those are classes that everybody has to take. That's like epidemiology, systems. Then you get your concentration courses. And that's what these are. They're specific to your program. You actually have 2 internships that you will take. This is also why they're number one, is that they have a lot of impact within the communities that they're serving, whether it's here or in Chapel Hill, to make sure that not only what you're learning, are you then able to create opportunities for other entities, in Chapel Hill or in UNC. But a practicum would be a class that is 200 hours of work with a UNC community partner in this case. And then you would do that again for your culminating experience in the spring of your last year. In addition to that, you have a comprehensive exam, which is basically one exam that everyone across the entire 9 concentration school of Gillings takes, just to make sure that you understand public health, you understand the mechanics and the basics of what the core has taught, and then how you would address certain questions based on your curriculum. And then we talked about electives. They're called selectives because we will take care of them for you, but they further bolster your concentration courses to make sure that you are learning something that is applicable to rural or place-based health. Okay, so who teaches in this program? We have a lot of great instructors. Currently, the director for the Health and Human Services office of Buncombe County is a professor right now. So there's really interesting networking opportunities where students like yourselves can work with, yes, Gillings teachers that will come to Asheville to teach programs or to teach classes. Yes, you'll have UNC Asheville professors and also MAHEC practitioners, people who are already pharmacists, dentists, or research scientists, depending on the class, will all teach you something based related on the course that you're taking. So pretty cool. You're not just having somebody who is a seasoned academic. You're actually learning from people who are practicing, and that's a big deal. Okay. So who enrolls in our program? We've got public health and healthcare professionals. Like I mentioned before, we have the entire UNC Health Science building that has a lot of practitioners and providers who are interested in advancing their skills and providing immediate impact to our region. We have recent college grads. So it could be this population that I'm talking to today, and that would be to improve community well-being, collaboration in government, or within industry and health networks. And then lastly would be those who might already be working at MAHEC, at UNCA, or in Chapel Hill, and are interested in moving out this way, but interested in specializing their knowledge in place-based health here in Asheville. All right, so where do our students come from? Again, we talked about this a million times, but we have students who have so many different backgrounds, which I think makes for a really rich cohort. My cohort, we had pediatricians, pharmacists, in addition to people who worked with the department or the Department of Housing for Buncombe County. But up here, like you can see, pediatricians, hospital admin, behavioral health, education, those who are actually going to medical school, who are nurses, dentists, midwives, or work in nonprofits. So basically, like I said, this is like a means to get to the end where you want to be. So if you're interested in reproductive health, you can use this to basically, if you want to go into health policy one day or policy in general, use this to become a health policy analyst, to better understand why you can advocate with tangible data for a specific policy that affirms care. Okay. So again, we recruit interprofessional cohorts representing diverse academic backgrounds and life experiences. Even though this is the #1 program in the country for public health, that does not mean that you have to have the highest GPA, that you have to have the highest test scores. We actually don't even ask for a GRE any longer. We'll talk about more entrance requirements in a minute, but we really ask for those who are really the movers and the shakers, the people who are making this impact presently and have lifelong goals of continuing that. So that's what's more important. That's why Gillings is #1, because they kind of really want to figure out the student and the whole student. So what are people saying about our program? Students have told us that they had high expectations coming into the program, rightfully so, and our program surpassed their expectations. That's really cool. Some people said, I feel like we're getting VIP status on the site visits around WNC. Yes, because when people know that Chapel Hill's here, that's kind of like a public Ivy League school. Unfortunately, people think about you differently. They're like, you must be an expert. You're like, no, I'm just learning. Like, I don't really know anything yet. That's how I feel. But people will look at you and they'll say, well, you must know since you're going to a top school. How can I do this better? And I'm like, no, I need to listen to you. I need to learn from you to actually do this better. That's what that would be in reference to, is you get VIP status because it's a really cool program and a really good school, kind of like the Asheville School of Pharmacy. You know. Graduates say I was offered a Center for Disease Fellowship specifically because of this. When I was at the VA hospital, heard about it, and they bumped up their salary offer considerably, made me an offer I could not refuse. Because of course, having a master's, but having a master's from the top accredited program in the country, and something in particular that was of interest for a government body. Preceptors are the people that actually would be your supervisors at the internships that you'll be taking if you are part of this program, the ones that we talked about, there's 2 of them. So those preceptors at their partner sites said the project was a tremendous help for our organization, and the neighborhoods we partner with, the neighborhoods we partner with exceeded all of our expectations. The students were extremely professional, engaged deeply with community partners, and delivered exceptional work that will have a lasting impact on the Asheville neighborhoods. So just an example of how a big part of this work is making sure that, yes, you are doing impactful work, but you're doing impactful work where it matters. And we're looking for students who are interested in staying at WNC in particular. You can go anywhere you'd like afterwards, but we do prioritize students that want to foster and lift up an underserved, underrepresented region of the country and of our state in particular. Lastly, employers who have hired our graduates, we decided to hire your graduates over other candidates with a doctorate because your graduates' analysis were more sophisticated. Again, going back to classes that we'll take, like biostatistics, research methods and measures that will help better understand how to take a data set and do something with it to actually advocate or to educate others based on what you determine through evidence-based practices are the best ways of communicating what's good, what's bad, what's unclear about available research. I'm not great at math. I really love these courses. And if anybody's worried about math, talk to me about it because they're not so scary. And there's on YouTube videos that help you understand your coursework. But I guess you're doing that now. So we talked about this slide. These are some of the practice projects that students have completed as a part of the program. We talked about working with the Asheville Racial Justice Coalition. We talked about the MAHEC student nurses, Western Area Community Forum, Medical Society, a lot of different areas you can take your experience. What they all have in common is that we're taking people who are interested in population and individual health, and we're giving them the tools through data analysis and programming and advocacy to understand how to basically take blank and turn it into a policy, how to take blank and turn it into a research program or a social program, or how to better analyze systems in motion and action and see how they're serving or not serving the intended population. So, all right, what can you expect after you graduate? It's a 2.5-year program. Tuition is set by the General Assembly of North Carolina, just like this school. It's a UNC system school. Right now it's about $1,000, 42 credits. So it would be about $42,000. However, we do offer scholarships from MAHEC at $10,000 and also financial aid for Gillings and awards. If you're interested in applying, I think some of you are graduating this year. If you apply by December 1st of this coming year, you are eligible for financial aid for the fall 25 cohort. And the same is true that if you are interested in applying for this upcoming fall 24, but fall 25 cohort, if you apply by basically 2 months before the deadline, so March 1st of that year of 2025, you can also take advantage of the MAHEC scholarship. We are currently ending applications for that right now. for the class it's entering for. So all that to say, what can we expect after you graduate? Our graduates do a lot of different areas. Like we talked about, you could be managing public health initiatives. That's what I get to do, and I get to publish, go to conferences, talk about them, write really long papers to say, please just make this fundable. Work as a nonprofit organization lead, you would actually be able to really take leadership positions or senior positions on a variety of roles. People work in clinical practice if you are interested in doing this, and then jumping into medical school or getting your PhD in something in particular. Now, for me, I'm really interested in Gillings' Doctor of Public Health program. And so this is something that sets me up to be able to do that. If that's something I want to do in a couple of years, that's an option. Continuing on to medical school and staying in current positions with, of course, pay raise. Ideally, wherever you are at, if you are getting paid with a master's, you will get paid a little higher because you have more specific knowledge for what you're doing. And of course, students work all over the place. They work in government agencies, nonprofits, health centers, MAHEC, public health departments like the county, and then also colleges and universities. Actually, my position is split between MAHEC and UNC Gillings. Not doing this, I'm also running the student health ambassador program on campus here. So there's a lot of interesting ways you can do public health work that might not look like public health outright. So yeah, we talked about how this being a distance program of UNC Gillings. This is designed for working professionals. It's 1 day a week. So all of your classes, instead of it being in the traditional model for other schools, a Tuesday, a Wednesday, random hours, midday even, all of your classes are on 1 day a week. So you can plan around it. They're either on Tuesdays or Thursdays, and you can spend the rest of the week knowing all your papers, all of your classwork will need to be completed by that Thursday or that Tuesday. And then, yeah, we promote a cohort-based learning model, which means that you grow with your team. So everybody you're in class with day one, ideally has stuck it out and you are growing together by the end of that 2.5 year cycle. So it's 2 years in the summer. All right, let's see, if you are interested in applying to our program, there are a couple of things that are pretty ubiquitous across most other programs. You need to gather your transcripts, 3 letters of recommendation, and then a statement of purpose. It's basically your essay, your graduate essay, and then your resume for what work you completed to date. And then there's a program called SOPHIS, School of Public Health, application site, I believe. And that's where you will go in and just say, yes, I'd like to put all this information into SOPHIS and click place-based concentration in Asheville, find our program, and you click submit. And then if you have any other needs for financial aid or scholarships, don't find those as well. But yeah, that's about it when it comes to that. Again, transcripts, letters of rec, statement of purpose. And I bet you have maybe half of those right now, or about to if you graduate. Okay, yeah, and we help with application fees. We're just starting this process. And if you are interested in getting on our mailing list, we can let you know when you can apply for free. It saves you about $250. Yes.
So to apply, you should just do it yourself, those basically.
Yeah, that's what, there's a few thousand schools of public health in the country, and everyone's required to go through there.
So there's no like secondary, like I just box.
Yeah, that basically allows us to communicate with you instead of it being like off the books application, which would be pretty sketchy. It's good that we not do that.
I meant like just do a certain website and you were just
You didn't make it sound like that. No, I did. But yeah, that's basically why. A good question. So if you are interested, or if you want to have a private conversation about what you're nervous about, what you like about the program, welcome to scan these QR codes. Mine is up there on the top. You can schedule a meeting with me, 30-minute meeting, and just talk about what you find interesting, what you are unclear about. And maybe if there's a direction of medicine or health that you are interested in, how it connects to public health, because it might or it might not. And maybe another degree is a really good connection. I'd love to make sure you get there. But yeah, I believe strongly in this, and that's another reason why I'm excited to come back to UNC and talk about that. So yeah, I think that's everything I had for you all today. Massive presentation. Yes.
How large are the cohorts?
They are kind of changing, but they're not exceeding 25. Our cohort used to have about 10 to 14 students, and now they're going to have, because we grew into a bigger space because we were having a lot of interest, they're now going to be 25 students or less. That's not bad. Yes.
What is the pass rate of the final exam,
Um,
or what has it been like?
they usually don't fail. Like you have to do something terribly wrong to fail, and I was super nervous because I don't like doing tests. And I was like, can I just go do a project where I have to show something? They're like, no, you have to take the test. And it's actually an essay test. So it's, you have this problem and they're trying to increase, there's really low adherence to vaccination. Why could that be? And you'd have to say, oh, from a public health lens, focusing on place-based solutions, could be because of mistrust, and you just list out, I think, why. I think some of it. Yes.
What is the acceptance rate of this?
Gosh, I don't know if we publish our acceptance rates, but it's like pretty around it. Yeah, it's actually more of if you can meet the minimum requirements, then we'd love to have you part of the program. So basically, I don't think they post online, but if you can meet a 3.0 or greater GPA, which is pretty standard for grad schools, if you have letters of recommendation that speak to your actual professionalism or the skills that you've done, and they are related to health and wellness or place-based health, you're good to go. Good question. Any other questions? Yes.
So there are a lot of students that go from this program to PhD programs.
Yes. Another slide that I have on another presentation, gosh, I hate putting these together, but there's a lot of them. There is a slide that Gillings likes to talk about where they say 99% of Gillings graduates within 1 year of graduating either have a job or go back to getting a PhD or med school. So basically everybody's doing something. So, yeah. Anybody else want a squishy brain? I feel like you too. Like you deserve some, right?
I think social brain.
Sure, whatever. Okay, cool. All right, you gotta catch it. Oh. Okay, cool. There you go. What? Nice. Very cool. All right, let's see. Any other questions about the program or anything that maybe we didn't cover today that you would be interested in? Yeah.
What students do for part-time work oftentimes?
Part-time work, like when they're in the program? It's a great question. Let me use myself as an example. I was working 2 jobs when I went to the program. It's again, work for working professionals. It's 1 day a week. So I was able to build a working schedule around knowing, okay, I could not be at that time. Classes were on Fridays. So I was like, all right, I cannot work Fridays, but I will work any other shift the rest of the week as long as, I can get those off. I worked as a front desk agent and a valet, full-time. And then I also had a part-time job getting my foot in the door at MAHEC, working as a health communications specialist about 12 hours a week. So I would say it's more about finding an employer that will work with your schedule and allow you to have that flexibility of knowing 1 day is just off limits because I trust you, or trust me. You do not want to go to work after having like an 8 to 5 with an hour for lunch, but like an 8 to 5 working schedule, classwork schedule. It messes with your brain. You've been doing like all these intense thoughts, critical thinking all day. I was awful at work when I would go to like work at 5 or 7 o'clock at night. I was like, I can't do this. So take the day, but work around it. Yeah, in terms of jobs, I mean, you could really do just about anything. It depends on like what you're interested in. I think I heard maybe this table over here was like reproductive justice. Yeah. So I mean, like if you got a job at, oh gosh, was it Our Boys, right? You can get a job at Our Boys, answering calls or working as a coordinator in some capacity. If they let you just have Thursdays off, we'd have it set up. Or you could be like that and a waitress, but making ends meet in that way. That's how I was able to do it, is get a couple of jobs. Does that answer your question?
That's a good thing.
Yeah, cool. And like way more information.
On the application,
Yeah.
when you're looking at candidates, do you want to see someone that's in the med field already? Or has worked in it in any capacity?
It's not important. Doctor's not the future of health. Everybody's the future of health. So it's really about how you're doing that. that are impacting WUNC or Asheville area. But it definitely helps. So if you are interested in going on to medical school, putting that in your personal statement does make you a really strong candidate, just to say that you are committed for a long term. Versus like, I don't really know, I'm trying to settle, see where it takes me. But if you are somebody who says, yeah, I went to UNC Asheville, I have a degree in health and wellness, I did this while I was there. And I really have a love for, blank. That's still equally as valuable. We want to have students from a broad array of backgrounds, and you're not too young to consider a program like this or too inexperienced. What you're doing already has value. Okay. That's some really good questions. Normally people just sit there and they nod, and I was like, oh, okay, cool. Actually didn't cover. There is, and this is just not, it's not important, but I was just thinking of like fun questions or fun things to tell you. At MAHEC, we have a cafe, and students during their lunch break.
Same building.
Yeah, you've probably seen it, right? The Hive.
Yeah, I ate at it on Monday. It
So, what do we think?
was pretty good. I
That's
had a
good.
euro. I mean, it was a little expensive, to be honest. I think it was like $20 for a euro and a parfait, but
They know doctor.
I mean, I did enjoy it and I wasn't hungry for the rest of the day.
$20 we'll spend. Yeah, good food. You have a lunch break, and it's like what? Well, I was gonna say it's like 20 steps away from our program.
Yeah.
Yeah. So,
I mean, I had to walk across the parking lot, but even if you're in another building, it's pretty convenient.
it was pretty rainy this week, so maybe you have a good
I
day.
had it on a sunny day. Monday was pretty sunny. I sat outside.
Good for you. Yeah. Yeah, so that's good. I mean, it's also nice. I think MAHEC's a really great location because you do meet, I will say, you meet and network with so many individuals. It's like a pressure cooker for networking and opportunities. That's how I actually got my start at MAHEC and why I'm still employed there. Something they are doing, and this varies by year to year, and this would be important for students like your age. And I wish this existed. When I was there, they had research assistant positions that were made available. And that's how I got my foot in the door to talk to one of the program managers who was doing a program on substance misuse for the justice system here in Asheville. And getting buprenorphine into the hands of doctors and providers who could prescribe youth and getting people in treatment. Now that's not needed, but that's where I got my start. And after that period, a lot of doors unlocked because a lot of people recognized my work and they had asked for me to be on their teams moving forward. That was a grant. I still do grant work, but that's how I got my start. Now what they do, which would be important for you all, is they have TA positions. And that's dependent on Chapel Hill funding that they allocate per 9 concentrations wide. But I know for this upcoming cycle for fall 24, some students can actually get, yes, they get the MAHEC scholarship, $10,000. If they're doing financial aid, they're also getting financial aid. On top of that, they could be a TA. So I guess maybe back to your question about employment, that could be another way of leveraging. I don't know how much it is, but it's a paid position per hour per week. So it would be adding up to like at least $8,000 to $10,000 minimum, because MAHEC pays a living wage for Asheville, which I think is like 13 something, 75, 13.50 per hour. It changes and it fluctuates, but no less. So that would be another opportunity for young students as well. They get experience and to take off from their loans. Yeah.
Can we get you back for grad school?
Yeah, I was doing the same presentation in Chapel Hill in October. I'd love to do that. Let me know. Yes, okay, well, cool. Is there anything else maybe we could talk about or address before I head out? Yeah.
If you could, this wouldn't, I imagine not in your presentation since you didn't show it, but if you could pull up like the 22 core competencies of public health training. I got it from one of your people.
Probably did. I don't know if I have that as like a student. The competencies, I don't know if I have that, unfortunately.
No, maybe I'll email it to you guys. It's
Yeah.
cool. I liked it.
Yeah, it's really great because that's what Gillings utilizes to say what competencies or what skill areas you'll develop as a part of this program, but focusing on place-based approaches versus like, you know, in general, yeah, exactly, or focusing on disease mitigation, which would be like epidemiology or nutrition. But yeah.
Is there a communications concentration?
Communication, so like new media.
So I'm
communications.
primarily interested in translation accessibility,
What was it?
translation
Oh,
accessibility.
yeah, language justice.
Yes.
Yeah,
Is that a concentration? Or something similar enough?
that is super, super niche. I don't know if you, some schools have health communications, and that's what you're describing.
Yeah.
That's what you would need to look up is health communications. Language justice or language translation would not be something that,
Yeah.
funny enough, I just held a seminar, a 3-part seminar with MAHEC on language justice back in October, and it was really well received. But that's a big deal here. That being said, because you can kind of bend an MPH to like what you're trying to accomplish. So it's like, okay, place-based solutions, but for who? But for what? I think on one of these, doesn't show on the projects. We worked with partnerships like Vecinos and Sensole, which are language justice organizations, nonprofits, partners in WUNC. So if you were interested in this, you could actually do an MPH while focusing your 2 internships, which can build off of each other or be independent with a language focus. So, oh yeah, like for me, I did mine on substance misuse in rural Appalachia, and we developed a whole equity module to teach providers how to serve communities of color who are misusing substances. You would do the same thing, but exactly what you just said. Language translation for Hispanic speaking individuals in WUNC or for migrant farm workers, or it could be for Korean native speakers who are working in university settings or Russian speakers. Those are the 3 biggest languages. Ukraine. Yeah, Ukraine.
Tagalog's big here too.
That's really cool. Yeah, the top, yeah, Spanish, Russian, Ukrainian are the ones that have the largest following. I would have expected that. That's cool.
Mhm.
Thank you.
Big here and some in South Carolina, like Greenville area.
Definitely there. I was going to say there, Greenville and Charlotte,
Mm-hmm.
or Columbia, not Greenville.
But there's a surprising amount here.
That's awesome. Well, chase that. If you think there's a thread to select poll, chase it and talk about that and say how their existence in WNC Asheville, WNC area, is inhibited or improved, or they receive different access because of language barriers or translation, because of it being probably the 4th biggest language. It's not actually part of what MAHEC or maybe UNC Asheville does to serve that community. Or maybe it is, it's something that needs to be done on a wider scale. That would be a version of attaching that. But yeah.
I think you mentioned an initiative, your initiative on campus.
Yeah.
But do you want to talk about that?
John, want to talk about that?
Yeah.
Sure. It's been like 4 years in the making. The Student Health Ambassador Program also helped lead our health policy initiative on site, which is all done through the Center for Health and Wellness, which is in Michelle Center. The Student Health Ambassador Program, basically, it was in response to the pandemic, which is so crazy. I think that's nearly 4 years behind us. I think like what, next Friday marks the 2-week hiatus. It's like, just chill out at home, guys. People did not. But basically paid 45 students to be community health workers on this campus and 5 other campuses across 4 counties in Western North Carolina. And they were doing everything from meal delivery to checking up on student symptoms during quarantine isolation. And then as we moved away from centering on COVID, unfortunately, and as the CDC kind of lost a backbone on talking about COVID, we had to pivot and we transitioned into focusing on health promotion and thinking about how students, you all, are representatives of the community that we'd like to improve health outcomes for. And so students now provide our student health ambassadors. Team's kind of small, but we will share a student health assessment, ask a bunch of questions for a bunch of, or anybody who's interested on campus to figure out what the needs of the campus students are and to try to address them through project work. So it could be access to safe and reliable contraceptives. It could also be connecting students to substance use support. Could also be a student, one of my favorite projects was connecting students to providers of color or providers of intersectional identities who would support gender affirming care or just care that was right for their culture. So yeah, really cool thing. I wish it would continue. It was grant funded and it will live on, but as something totally different in the future.
What about the health policy?
Health policy initiative?
Yeah.
You guys are full of questions. I love it. I can talk way more about this stuff. The health policy initiative is, that's a 6-year grant from the Dogwood Health Trust Foundation in improving, basically educating and providing as a central weekly venue, educational opportunities for policymakers, the heads of organizations, so like MAHEC, our CEO for MAHEC, in addition to other local leaders. Sometimes we get council representatives from the Cherokee Reservation to also attend, but to think about and learn and facilitate conversation around health policy needs or health topics that are of utmost concern for our region. And then how to connect people in the room to actually sharing resources or thinking about how it impacts others outside of their health system, outside of their organization in our region. And then working with legislatures to really prioritize these bipartisan topics.
How do they get involved with that?
How do you get involved with that? At this time, we are starting, we are taking on student interns right now to help facilitate those conversations, to also be in the room and to put together legislative caucuses. So if you're interested, just let me know.
Cool, because I'm planning on doing it in DJD and in PH. So.
You're just gonna be like a professional
Yeah,
student.
I'm gonna be.
Yeah, Chuckles gonna be like, whatever, we'll do it, like, yeah, the check cleared. Very cool, that's awesome, so like a law degree, you'll be a doctor, you'll also have your MPH, it's very cool. I don't know if you know this, but with Chapel Hill, they actually offer an MD MPH.
Yeah, I did see that, but I kind of want my medical degree to fully be built on the foundation of public health. Rather than starting medical school and then learning public health.
Yeah.
I want everything from medical school to connect to the public health rather than fitting in.
That's very interesting. Okay. Well, I know Chapel Hill has like the #1 primary care, concentration, so it'd be a cool way of doing that. And then coming back to Asheville, because MAHEC, to kind of keep it all in the family, MAHEC has really high placement rates for residents that want to do their education here in the region and also serve rural Appalachia. You got a long road ahead of you. It sounds like you're excited.
Yeah.
Yeah, I like that.
Well, thank you.
Yeah, of course. So glad you guys want to have me.
Yeah.
And yeah, thanks to Andy for connecting and making this possible.
Emily's actually my roommate, which is funny.
I heard that. Yeah,
Like, she sent me an email and I was like, you couldn't just ask me, I live right next to you.
that's exactly what Andy said. I didn't realize my roommate was such and such. We were like, how it goes. How it goes. Well, cool. Thank you all very much. If you have any questions, if you have a question, you raising your hand? Kind of.
I have, it's not related to this.
That's perfect. None of these questions have been related. No, I'm kidding.
I've heard about the student health ambassador program.
Yes.
And I'm very interested in it,
Yes.
and I just don't know I haven't been able to find very much information about how to get involved.
That's fair, that's fair. So it is gonna be concluding because we just entered our grant funding.
Okay.
So it doesn't have like a new hire opportunity moving forward at the moment. But if you are interested, I would personally ask, Aubrey Rote, who's the chair of the Health and Wellness Department currently, starting in the fall to see if it has been started up. Because we just ended grant funding for 4 years, and so they were like, oh, the university has to shoulder it. And I don't know if you guys have seen the news.
Certainly have.
Why are you laughing? No. I'm sure they're heartbroken. But yeah, that's kind of the reason they're also like, oh, let's like revisit everything we're doing and take a look. But yeah, ask Aubrey and then ask a few other people that might be in that department. I don't know what they're doing with it next, but I'm happy to do a good job if they want us to come back. Cool. All right. Well, thank you all very much. On the cards, you have my information on the very back. My name's Cole Gold. And you got my email. If you have any questions at all, even if they're silly, send me an email. Really don't mind. And and whenever I reply to that email, there's a hyperlink in my signature to book a meeting if you also want. Yes.
Sorry, totally random question.
Do it. Yeah.
Are they looking for any experience or anything on this like resume? Like, for example,
Yeah, but it's most likely something that you're undervaluing in yourself already. Because if you've done this type of work, I'm gonna guess, if you've done work that's related to health or promoting health at the university level because you had a part-time job, or because you've been volunteering for years with something in particular, talk about that, speak to that, talk about the parts of you that are connected, and create a through line beyond just, I was a CNA and I did this. It's like, no, we want to know like the actual person who wants and will continue to do work. That's like the
You can also like look at your resume and be like, you can take a stand on this part, so they can support you a lot and like making your resume tailored for them.
Yep, and man bun to man bun. If you want help with your resume, or you just want to ask that question and be like, meet privately and say, hey, does this actually even make sense? Like, how would I craft my whole story to apply to this? I'd be happy to help you.
awesome.
Yeah, you just let me know.
Thank you again.
Yeah, thank you so much for having me. You guys go for class. Yeah, it's like one up here. All right.